Hello and welcome to the latest in our series of NR Times webinars. My name is Alistair McCall and I'm going to be hosting today on behalf of NR Times. Today we're focusing on a crucially important subject, designing a brighter future after a spinal injury. So our aim today is to provide really a reference point. Where are we now with spinal injury treatments, and where can we seek improvements, and over what kind of timescale, and what do those improvements look like? And along the way, we'll try and highlight excellence in terms of practice and treatment and outcomes as well. So I'm delighted to say we've got a great group of panellists with us today who have agreed to share their insight and their opinions and, of course, their experience with us. And I'm going to ask those panellists to introduce themselves, say a little bit about themselves, their organisations, and their areas of specific interest. And then we'll dive into the core subject of designing that brighter future after a spinal injury. So I'm going to kick off with Emma. Emma, would you like to introduce yourself and say a little bit about yourself and your organisation?
Yes, of course. Good morning, Alistair and everyone. Absolutely. So I am a senior associate at Stewarts. We have two offices, London and Leeds. I'm based up north, so I have the benefit of all the rain and the clouds and the good food, arguably. So I work in the personal injury team at Stewarts, and we as a team exclusively represent claimants who have sustained catastrophic, life-changing injuries. And those are primarily spinal cord injuries, brain injuries, amputations, and a kind of severe polytrauma. So, I mean, as well as representing the individuals in legal claims, a very important part of the work that I do and that we do as a team is providing a free legal advice service to patients in a number of different clinical settings. So although the primary role is revolving around bringing compensation claims on behalf of claimants who have been injured through no fault of their own, the focus on the free legal service is really important to our team, and that is available to people whether they have a claim or not. So does that give you enough of a flavour, Alistair? Have I answered? Hopefully I've given you a bit of an introduction.
That's great, Emma. Thank you. Yeah, it's just helpful for those watching just to understand where your real focus is.
Sure.
And of course, as we work through our panelists, everybody's got a different experience and different specialisms.
Yeah.
Alice, can I ask you to introduce yourself, please?
Yes, good morning, everyone. My name's Alice Bruce, and I'm the Clinical Head of Rehab Services for CHD Rehab team. We are part of the CHD Living Group, which has homes which are family run across Surrey, Hampshire and South London, and we have two rehab services there. So our rehab services are predominantly neuro rehab services, looking at after people following acquired brain injury, spinal cord injury. And we also take sort of long-term disability management of people who've got a spinal cord injury, perhaps whilst they're awaiting housing or further adaptations to home. And we take people for specialist nursing care as well. I worked previously in the NHS for a long time before being in this role, and sort of really part of this role is collaborating with the NHS and with the community services to provide and structure the way that private rehab services are provided and how we collaborate with the teams across the community.
Great, thanks very much, Alice. And Andrew, I know your background and experience is very different in terms of specialism. Can you introduce yourself and say a little bit about your organisation?
Yeah, absolutely. Good morning, everyone. So my name is Andrew Vallis, and I'm a director and head of architecture at PLG Consultants. So we work with the teams involved to address any property requirements for individuals. That could be in immediate housing needs, so putting people into rental accommodation right the way through to forever homes, and trying to provide solutions for an individual right throughout that process from start to finish. we work nationally. We've got offices in Leicester, London, and Newton Abbot.
Great, thanks very much for that, Andrew. Can we kick off just by going round the panel and asking about the current state of play? What's working, maybe what's not? Where are the challenges and where are the opportunities with reference to creating a brighter future after a spinal injury? And if you don't mind, Emma, as we started off with you, we'll maybe go in the same order again.
Yeah, that's absolutely fine. Excuse me. I'm not sure how much I'm going to be able to help with kind of clinical settings and things, but I'll do my best. One thing, you know, when we talk about this, I was reflecting upon the challenges for people, and I'll start with challenges, Alistair, that's kind of encompassed in your question, for people with spinal cord injury in the early stages. And I was looking back and reflecting upon a training day or conference that we had at Stewarts in our Leeds office in February. And it was kind of our inaugural spinal cord injury conference. And the focus of it was supporting people with spinal cord injury beyond the dedicated spinal units. And one thing that was very kind of clear and kind of set out at the beginning was that actually the majority of people who sustain spinal cord injuries are not actually treated at one of the 8 dedicated specialist spinal cord injury centres around the country. Sometimes they are seen in a spinal injury centre, but repatriated quickly to their local hospital, or they don't even make it. You know, the number of admissions and applications to be admitted to a spinal centre is just way over and above the capacity that those centres have. And that's, you know, for a number of reasons. I suppose the UK population is growing, the incidence of spinal cord injury sadly is growing, the average age of people who sustain spinal cord injury is on the rise. More people are surviving spinal cord injuries now than previously, but the number of beds available in the units has stayed relatively constant. And maybe that's a trite thing to say. It's an obvious problem that people are not being seen in the specialist settings initially necessarily. And that is a problem for patients and for the NHS. You know, it's a huge issue. I know that, and this is again just harking back to the conference that we had in February, I know that different trusts have approached the problem in different ways through outreach models. You know, there are different models of care kind of adapted in different centres to try and ensure that this challenge in ensuring patients are receiving the best care and the best rehab outside those dedicated centres. There's different ways of doing it, different approaches adopted. And that's where I think things like the conference we had, not that that's the only setting or even the primary setting for this type of thing, but pooling those resources and looking at how different clinical settings are dealing with the issue, I think is super useful. I am obviously no specialist in making any kind of suggestions about how that be managed, but I think that kind of crossover between trusts and their experiences is super helpful. And Alice will be able to tell you better than me that kind of communication and collaboration within teams that extends well beyond kind of those acute settings, but you know, and continues as a theme throughout rehabilitation. I think that's crucial. And as always, Alistair, and this is probably a trite thing to say as well, but you know, every injured person is so different. Their circumstances are so different. You know, their family setup is different. Their homes are different. Their needs are different. They might have the same level of lesion as another patient, but have completely different needs. So, and I think one of the things that I find a lot in the work that is kind of is lacking is the provision of psychology and kind of psychological services post SCI. And I think understandably in the acute stages, we're looking at the acute medical issues and dealing with those as and that's proper, and that's what needs to happen. And I think there's probably just not the provision there for on the psychological side of things. And I did a kind of session with a lady called Jane Duff, who's a consultant clinical psychologist at Stoke Mandeville, and she, we were talking about, she'd written a report and looking at a pathway for psychology input for adults with spinal cord injuries, and we talked a lot about how the provision is just really lacking, and it goes back to funding, doesn't it? And that's just the age-old problem. Funding and filling gaps and provision of services and ensuring continuity of services and quality across the board. So I feel like I've just listed lots of problems there, with not many positives. But I think that at the early stage, particularly, the thing for a patient or a client in my case is that they are completely overwhelmed, not only with coming to terms with their injury, their life-changing injury, and how that impacts every aspect of their being, their family, their money, their household income, their house themselves. Can they live in the house? I mean, who sustains? Very few people, in my experience, sustain a spinal cord injury and can go home to their their home that was set up before. I'm sure Andrew will talk more about this, but the importance of, from my point of view, from a case point of view, and working with claimants who have legal claims, very much the focus is upon taking that kind of overwhelm in hand to the extent that we can logistically, working with case managers and an MDT to establish what the priorities are and making sure that all revolves around the client and their family. And I say family as well, because that is really important, in these situations to understand what the family's situation is as well. And understanding their goals and where they want to get to, which might not be an easy job in the initial stages, but doing all of that with a view to putting together a very bespoke kind of puzzle as to where the client wants to be, and then it's about mapping out how we get there, which sounds like a very vague thing to say, and I suppose it is, because for each person that looks different, I think. And ultimately for us, it's about securing funding to make things happen for claimants who are in the legal process, and that can be depending on a set of accident circumstances, or depending upon who you have on the other side, who the defendant is, who the insurer is, and who the defendant solicitor is. That can make a huge difference as well in terms of access to funds. Generally, I found people to be pretty collaborative, but it varies from case to case, and it depends upon the specific circumstances. But when you have a case, and Alice and Andrew both know this well, where funding is not readily available, it makes things acutely more stressful for the claimant, for their family, for everyone, because there's provision that's required probably urgently and just can't be implemented. So I think that I've given you a really waffly answer, Alistair, to and actually a pretty simple question. But I mean, I think that there are masses of room for improvement across the board, and I think that hopefully I've identified a couple of the kind of the key priorities that arise in the claims side of things anyway.
Emma, that wasn't waffly at all. I think as we talk about creating a brighter future, you need to start with identifying where things can be improved. I think you've covered a number of areas there that will be sort of golden threads that run through this discussion. So thank you. No, that's a great way to start the discussion. Alice, I think that tees it up for you to talk about your thoughts on the state of play and where we are.
Yeah, so I think, interestingly, as Emma sort of started talking about at the beginning, one of the challenges is around access to perhaps that kind of acute rehabilitation, and how does somebody go from their acute injury and perhaps being in intensive care, where does that's when the journey really starts for them, and where does that journey lead? There's obviously a number of factors that play into that journey, as Emma was sort of saying, around their age, where they live, what services are available in their areas, and how the number of beds in those specialist service, in those specialist spinal cord injury service. How do we accommodate all these a growing number of people that are surviving a severe injury? Interestingly, from our perspective at CHD, we see people who have perhaps come from the spinal cord injury centres, or they have come from their district general hospitals. So they've been repatriated from the acute treating hospital, the first treating hospital, to their local centres, and they may not, for whatever reason, be appropriate to be going to one of the specialist centres, or the number of beds, that challenge around the number of people versus the number of beds isn't always available. So we are sort of in a unique position at CHD. So we accept people who are privately funded, but also through the ICBs and through continuing healthcare. So we see some of those people on a spinal cord injury pathway that perhaps haven't gone to a specialist spinal cord injury centre, but come to us for further rehab. And one of the big challenges is around, access to that specialist input. And as Emma was saying about psychology, and the huge impact that this type of injury has upon somebody, and accessing psychology and ongoing psychology and support for them and for their families. I think one of the things that people often say about the specialist centres is that there's also that peer support, and people are at different pathways or at different stages in their rehabilitation journey, and the specialist centres give them that opportunity to perhaps see what their future might be like, or what they might be able to achieve, whilst also sort of bearing in mind all their individuality and the different implications of spinal cord injury for each individual. And so being in services where they can see other people or can see peers with a similar type injury sort of helps with that psychological element of it as well. So I think, access to those specialist services is one of the challenges. I think that in sort of our area, in sort of the south, the spinal cord injury centres are really working hard, as Emma was saying, to collaborate and bring people together. So are creating a network. So I sit on a network with the spinal cord injury centres, so the two of them that are local to us, which are Stanmore and Stoke Mandeville. And then in amongst that, we have the training and the teaching hospitals in London, that the trauma centres that would be seeing these people acutely, plus then the district general hospitals that they would perhaps be repatriated to. And really that network is working hard to, share the resources, share that education across the board, to educate other professionals that are working in non-specialist services and really give them that outreach support, but doing it sort of as a networking system. And I think really that's the important part of the future, is sharing that knowledge and that educational resource, but also thinking about those functional resources, like linking people together. So as part of that network sit charities and the Spinal Cord Injury Association as well. So really linking people together and utilising a number of resources to support them into the future, and sort of sharing everybody's knowledge and experience, opening it up as sort of a problem-solving based scenario to have an opportunity to discuss and learn and meet people together. So I think that's really important for the future.
Yeah, that's really helpful, Alice. And I think as we go through the discussion, we'll come back to some of those themes that you unpicked there. Andrew, I know that you view things, and your contribution will be shaped around property, infrastructure, and Emma mentioned quite how important it is that we recognise when people suffer a spinal injury, they won't go back to a home in the form that they left it. Your thoughts on where things are and maybe where there are challenges and opportunities, Andrew?
Yeah, absolutely. I mean, almost all of our clients don't go home. So accommodation is something which needs to be considered right from the very outset. And as professionals, it's our job to help lead client teams and their expectations in terms of what that would look like. Firstly, it's about immediate accommodation. So, when people are going through rehab and they're newly injured, it's about setting expectations for what that would look like and working with client teams from the start, because quite often our clients will need to go into a rental home before we then look to provide their forever home, their sort of future home, and helping people to understand the fact that that is the process which needs to go, and starting that as early as possible is absolutely critical, because what we see quite often is when the search for the sort of intermediate home starts, it's almost always too late, in terms of it takes a long time to find a rental property and then to go through a process of adaptation, because, as I'm sure we're all aware, most rental homes aren't suitable or need tweaks in order to be suitable for a client and their family, and that will take a number of months to find, adapt, and then make somewhere suitable for somebody to move in. There's a lack of suitable properties available, both in terms of short term and long term, and what that often means is elongated stays for clients in their current situation. So starting the search early enough and being realistic is absolutely vital to make sure that everybody's expectations are sensible and also being met. That primarily involves working with teams to establish the brief at the outset, and then everybody playing their own part, and also understanding family situations, because, as I think Emma was saying, like, you can have two briefs which on paper look the same, but the familial situations are entirely different, and what that means is you end up going down two completely different routes in terms of what you're looking for, and establishing that right at the start will make everybody's expectations and jobs a lot easier. Equally, an understanding, working with client teams and to understand what the future scenario may look like, and also these short-term decisions in terms of property will allow you to then understand the long term, which quite often at this early stage is very difficult to foresee. People need to get to know their injury and what it means for them and their families, so that we can then make the best decisions for them and where they would go in the long term. It's all about understanding the short-term future and then future-proofing for what you think is going to happen moving forward. And quite often that's not a quick process, and it's not something which can be set at the outset, but it's about making some realistic assumptions which can then be adapted as you move forward with client teams to try and understand somebody's requirements more fully.
And it's worth saying, sorry to jump in, it's worth saying, I suppose, Andrew, as well, that part of your job is so tricky because things change. So, some clients feel a certain way about having care delivered in their homes. And, for some, it's a very, we see very, very severely high level spinal cord injuries, which necessitate a 24/7 package. And that is kind of what it is with lower lesions, and where it's not necessarily the case that a care package is obvious, and that medical need is less. Then I think sometimes what people expect in terms of their care, what they will subsequently accept, and how that might evolve over time, creates complications on tons of different fronts, not just from a home perspective. Does somebody need live-in care? Maybe not now, but later down the line, when will that be? What will that look like? But from a family perspective as well, and from having people in your home that you're not used to, and adapting to having to comply with things that necessarily you didn't ever think would be a part of your life. And that, I think that makes your job, both of you, Alice and Andrew, both of you, it makes it interesting, doesn't it? I mean, for Andrew, the goals change. And I suppose that's what you're saying at the outset. You kind of have to be clear about what, we're looking at and what's required. But then it's tricky when it shifts,
Absolutely. I mean, one of the key challenges we face is obviously people who've never lived with any level of care, who we then have to try and understand how a home will work for that person. And it's, it is intrusive, and trying to make some key decisions at the start and assessing properties to make sure that, what we try to do is put a client in the middle and have the care on one side and the family on the other, because it's quite disruptive for people. Families having to adapt to living in an environment where there's somebody else in there who isn't part of the family unit, who is then taking care of people, and if you were arguing about EastEnders or Coronation Street, having somebody in the background is quite unsettling. So trying to make sure that we're only sourcing and finding properties where you can put that person in the middle and allow them the care they need, while then keeping the familial side of stuff and the family working separate from that, is so important.
Which kind of loops back to my role, doesn't it, in a way? Because it's my job to anticipate how things, informed by the clinicians and the client, obviously, and kind of anticipating how things might develop in the future and what the needs are, and financially kind of covering that. And it's even trickier in in cases involving pediatric cases where there's a spinal cord injury, because if a child is very young at the time of injury, it's so difficult to predict what the needs might be and how they might change, without a long time elapsing, and that just is what it is. But it's there's a link between all of us, and between what we're all doing for the same purpose.
I think just sort of expanding on what Emma was just about, I think we're going to say it, but we have some younger people that are thinking about having families, into the future. So again, just an added dimension of how difficult it could be when planning for, somebody who might not have a partner right now, but is hoping that will entail be in their future, and that being at home and being in the community and reintegrating and all of that, who knows what that might hold. It's a tricky one.
Yeah,
it's a really interesting point, because part of the sort of key element of future proofing is having a look at how somebody's journey through life can be adapted within a property we're looking at, particularly when we're looking at a long-term home. And when it's a young person, and we're talking about how their life may develop, there's certain things you can do when you're assessing properties or you're building properties where you can help to facilitate that, whether that be having an understanding of privacy. And typically our client's accommodation tends to be on the ground floor, but making sure that there isn't overlooking, and that there is an element of privacy in terms of that between the familial spaces and the private spaces. Looking at how homes can be adapted in terms of when somebody is younger and they're living with their family, it might be that you have a few separate little rooms, because so you can keep functions separately, but then as somebody grows, making sure that those walls can be taken out quite easily, so that you can promote a more open plan style of living, even as much as making sure that as somebody's needs change, that the home is easily adaptable. Somebody may not need hoisting fully, but making sure that infrastructure is in place and everybody knows where it is, so that as somebody grows in a property, that can then, as their needs change, be adapted, and walls can be knocked out and hoist can be put in, but all the infrastructure is there, so it's quite an easy process, rather than having to do quite an invasive level of work later on down the line. These are all considerations as a team we can make early on, and then nobody needs to think about them until they're needed. But putting them in place at the start means that we don't then have to have a significant amount of work later on down the line.
Yeah. And all of that, I suppose, is underpinned by the assumption that funds are available, isn't it? And I mean, that's the tricky thing. We operate in a world of, for me anyway, we're bringing compensation claims on behalf of clients. So we're working on the basis that funds are going to be available to create these spaces. And of course, that's not the case for everybody. We're acutely aware of that too.
We may come back to funding, but can we talk about what a brighter future looks like? Where are the improvements, the innovations, the new approaches that would make a big difference? to those living with spinal injuries, or their families, or their carers, or those that are supporting them? Where are the areas for improvement? Alice?
Yeah, so I think sort of in a residential setting, it's about thinking about the adaptations that can be made. So thinking about like voice activation things that don't require somebody to be able to move their upper arms, move their hands, access to video, and perhaps like some remote sort of monitoring and things like that. So it's thinking about those adaptations that we can use all the technology that is available that utilizes their voice activation to shut their windows at night, to change their lights, to turn the telly on and off, thinking about those types of innovations sort of in a residential setting. And when we think about a lot of people, some people will very much maybe want to stay in a residential setting for a period of time, or as they get used to their life or their life as it is now. But some people will obviously want to go home, and thinking about, like Andrew was saying, about where the carers are and where the carers can be. But what else can we do like remotely so that these people that can continue to live their life as sort of as independently and as fulfilling as they can be, without perhaps a carer on their shoulder or just around their corner? How can we use the advances in computers and voice recognition software and all of those things to really make them as independent as possible? And I also think it's about sort of how does their life and their future, how is that fulfilling and for them, and what do they want out of the future? So we see some people who are younger who think about getting back to education. So how can we help them and support them to attend college or to access open universities? How is that supported for them? And thinking about some vocational rehab. And although for every individual there's going to be quite a few challenges of how we access that, but thinking about innovation and how we use that to access those things that they want to do.
Thanks, Alice. Emma or Andrew, thoughts on what that brighter future looks like, where there are improvements that would make a big difference, or innovations or new approaches?
Yeah, I mean, following on from what Alice just said, I mean, property considerations as early as possible are always going to be what we strive to achieve. I mean, access to automation is such a massive thing in terms of the difference we can make. We've got clients who can open their front door, go in, turn lights on, turn music, open the doors, call their lift, go upstairs, go into their bedroom, open the doors, sit out on the balcony and look over their beautiful view. And all of that is done with the power of their voice. And it's just absolutely amazing that these things can be achieved, but they need to be considered early and they need to be planned for, both in terms of cost and practicality, right from the very outset of this. So speaking to the suitable people in terms of what is possible, and also in terms of occupational therapists to make sure that what we're trying to achieve is achievable for that person is absolutely key. Another thing is as understandings of properties and how these things can affect people is growing, in terms of our business, in terms of the industry, just something as simple as level thresholds. What you have from a building regulations perspective would say that 15 mil is an acceptable level threshold for somebody going into a property, but actually somebody who lacks core stability going over a 15 mil bump into a property will make them feel like that can make them feel like they're falling and can have this hugely unsettling feeling. So understanding what that person is going to, how they're going to interact with their property, will mean that we can plan these things out so that they can have smoother transitions, and that their day-to-day functioning in a property will be as easy as possible for them. As well as, the independent side of things is hugely important. Advances in adaptable kitchens, making sure that people can interact with their properties the way they want to. So, and it doesn't have to be expensive. Something as simple as understanding how somebody can do something may mean raising a dishwasher a foot off the floor so that it's easy to access for themselves from a wheelchair will mean that they can then do that for themselves rather than relying on somebody to bend down and pick it up. And these aren't expensive things to introduce, but having an understanding of everybody and how they can work in their home will mean that we can then plan these things in right from the start. Sight lines, if somebody is going to be laying down a lot, making sure that we're planning views outside, making sure that windows are at the correct level, making sure that there are interactions with people. And these are all things which can be established early on. And, technology is helping us to achieve them in a much easier way as we progress.
Yeah, it's interesting that you talk about technology, Andrew. It clearly has a large role to play, but presumably, as you say, it is expensive when it comes to very personalised care. I'd be interested, Andrew, especially given your geographical spread, is there a bit of a postcode lottery, or is funding and support available fairly generally and consistently, whether you live in Newton Abbot or Surrey or Glasgow or wherever?
I would say largely it's consistent because the clients we work with have obviously had their needs assessed as part of the process they've been through. So generally speaking, there's an appropriate amount available to address their property needs. So I wouldn't necessarily say that if somebody lives in Newton Abbot or Manchester or central London that we would act differently for that area, because hopefully what is being provided is what is required, and that is what has been assessed throughout the process.
Thanks, Andrew. That's helpful. Emma, your thoughts on where the improvements are and what a brighter future looks like.
Yeah, I mean, I think that there's always room for improvement. There's room for so many improvements, isn't there? I mean, I think that one of the key things with this is that for spinal cord injured people, their kind of clinical needs from the outset are different. So from the other people that we deal with, brain injured people and amputees and all sorts, it depends. And we kind of have this in the spinal cord injury world, this trifecta of, bladder, bowels and skin as a kind of key things for newly injured people to get to grips with. And I think with those kind of medical needs in clinical settings and things, it's important that the kind of early intervention is and planning is super important. And kind of I know that some settings do it better than others, Alistair, and that's just a fact. Some outside the dedicated centres, people are equipped in different ways, and Alice is probably a better person to speak about this than me, but different settings are equipped in different ways. But I think that early intervention and assessment of need from the off and helping with those kind of core areas is really key. And as Alice mentioned earlier, I think her point about the peer support is really important, because I don't know many clients who haven't benefited when they've had input from peer. I'm going to let you interject, Alice, because you've probably got something better, more informed to say.
No, I was just going to say, thinking about what you're saying about bladder, bowels and skin, it's about educating.
Yeah.
Education, I think. There's a huge, physiological and anatomical changes that occur when a spinal cord injury occurs, and not everybody who perhaps hasn't seen it before or has not got that experience would not really understand sort of the total changes that occur that affect then bladder, bowels and skin and many other functions. And I think that's really key, is sort of educating the people, looking after these people, and like Emma says, as early as possible to get a bladder and bowel system, training system in place. And I know that the spinal cord injury centres and the outreach teams are working really hard to get out into those services, the trauma units, and really educate them for that early intervention, and then build that forwards throughout their whole journey. And then they become the aim that the individual then becomes the expert of themselves, and then that person often educates further carers and other people that live with them, or people close to them. And the peer network, I think, is really important for them. The Spinal Injuries Association has access to peers and a group of peers, but even in a much less formal setting, that there's other people living with you or within the rehab services or on the ward with you, just to see, well, if that chap can do X, Y, and Z, maybe that's something that I can do too. So I think it's linking people and networking and just being like, oh, I've got a chap who's has done this or wants to do this, and this is how you could talk to each other, if you like, and really using the resources of the people resources to support them and move them through their journey and hopefully have a positive impact.
Yeah, I think that's really that's true, as in terms of the spinal centres and those acute settings are amazing with those kind of core issues, and their outreach teams and what the work I know that some of the trusts are doing in terms of outreach to major trauma centres and other kind of settings are amazing. And as you've rightly pointed out, and this is something that I wasn't clear about, it was the dissemination of that information from that point down the chain to whoever, including family, I suppose, as well. The education stuff is super important. And I think that the spinal centres are really good at that as well, in terms of the family education too. Which is not my field of expertise, but my observation. So I think that kind of collaboration, I suppose, that we've touched upon is another kind of area for constant review and improvement. And I think that Alice will know this in a kind of an MD, and Andrew as well, kind of in an MDT setting, the importance of that kind of collaboration. And I suppose before we even get to the team collaborating, is understanding what the client's goals are. And I know that again sounds like a really obvious thing to say, but sometimes at the beginning, a client or patient don't know what their goals are, because they don't know what is going to be achievable for them. And that might change over time as well. But I think it's about understanding that, again, that early assessment, intervention, understanding what somebody's goals might be and how they might change over time. And I think that trying and testing is really important in terms of the legal case. So we would encourage claimants that if they had a specific goal in mind, to try and test things, including technology. We've talked about technology already, so I won't rehash that, but looking at all sorts of technological advances. We would encourage our clients to try them if that's an option, to establish whether something is going to be helpful into the future. And it might be something really simple. And, Andrew's already alluded to, the voice activated stuff. Some of it, the very basic stuff, is really accessible. And you can get stuff on Amazon. It's and it's completely affordable. So just trialing those small things and then rolling on to kind of bigger things is, I think, really important. And, for the claims that we deal with, lots of our clients will have access to private rehab and trying assistive technology. And we would always encourage people to try and just see what works for them, because if there's any prospect of that improving their quality of life, then, and some clients take a bit more, time to come round. And sometimes it depends on their age or, how they feel about things. And I think being informed about what's available and having kind of clinical reasoning and recommendations behind trials is really important. And with my lawyer hat on, it's super important from a claimant solicitor perspective for us to have details about what is being recommended and justifications and reasons and documents behind those recommendations, making it clear what the goal is, where are we aiming to get to with somebody. I think Alice is going to say something insightful again.
I was just going to pick up on your point where you said people don't quite know what they want, and perhaps they're not quite ready to accept what might be helpful. So often we're in a fortunate position with our in-house therapy team, that somebody who comes to us perhaps after the spinal cord injury centre, they might have at that point, for example, not wanted to have an electric wheelchair that is controlled by a head switch, because they weren't ready to accept that perhaps this is what the future looked like for them. And in coming, to a service like ours, we've been able to then sort of re-explore that. So an opportunity for, regular review, if that's, on a daily or weekly basis, or even if that was like a 6 monthly or even a yearly basis. People are, evolving and moving through their journey all of the time. And so something that 6 months ago, they definitely 100% didn't want, now, they might be in a different place where actually this is an opportunity to try it and to use the access to those equipment and things that they may not have had before. And you can do all the clinical tests, you can have all the scans, you can do all the ASIAs that you like, but there is a little bit of, there might be some changes in the future, and then what technology or what equipment can we use that gives them a greater level of independence or that sense of purpose or that sense of meaning, even if that's a longer period of time down the line.
Yeah.
I'm going to try and sort of, move us towards a conclusion. We've covered a lot of areas. Just before I do that, and I'm going to go around the panellists again and just ask for some final thoughts, but is there anything we haven't covered that anybody would like to spend some time talking about before I do that? No, well, what I'd really like to know is, and I'm hoping there will be legislators listening to this and people who have an influence over the future of spinal injury care. I'm sure that will be the case. If you had a message about, I guess, one big thing, and it may not be that big, one thing that you think would make a real difference to the future for the treatment of spinal injuries, or the environment for those, living and working with or in, some sort of spinal injury care setting, what would it be if there was one thing or a message that you'd like legislators, decision makers, those with influence over some of the things we've touched on? What would that be? Emma, we started with you, so I'm afraid I'm going to start with you again.
That's okay. That's a really hard question, Alistair. I think that we've already talked today about how many different areas where we can look at improving, and that we go back to this issue of funding, and particularly the NHS, that the funding situation's really hard. So I think one thing to make things kind of improve things, I think that probably for me is the kind of continuation of discussion and collaboration between lots of different agencies. I think has proved, and Alice talked about this earlier, really helpfully, thinking about what somebody might be doing that's working for them and sharing that information is so key. And then I suppose in turn, providing a dissemination of that information or education, whatever it might be, to patients and their families, and there being kind of a transparency around what is working at some places. In an ideal world, we'd say, can we have a massive cash injection to improve provision and all of that sort of thing? But realistically, I find just huge benefit, and I'm not a clinician. I'm just not in that setting. I'm not qualified to comment on it, but I find just from observing and watching that so many people have benefited just from looking at what their next door neighbour or, you know, 2 doors down or whoever, what they're doing in different clinical settings or even, you know, post-discharge at home, what's working.
Great, thanks, Emma. Well, those are 2 really big areas, you know, that collaboration and education and awareness. Alice, your thoughts on the 1 or 2 things that make a big difference in the future?
Yeah, I think I would really agree with Emma that there are so many people with so many different skills and so many specialist skills within this area, just perhaps from different perspectives. And that networking and that collaboration to really thinking about the individuals themselves who've had this injury, I think that's the most important thing, and sharing that best practice across the services and getting outreach into places. So it's unreasonable, I think, to think that every single person is going to be with a spinal cord injury is going to be able to access the spinal cord injury centres. I mean, how big would they have to be? That's not something that's a doable or reasonable quick fix. But it's how do we take those specialist services and the knowledge of those specialists working in those centres out of there and disseminate that across the networks and across the regions and in all of the hospitals and in all of the settings where people with spinal cord injuries are. And then thinking also about how the private sector can support the NHS. So, and how is that? How does that look, and how does the access to that look? We are at CHD in a position where we can offer some of those expertise that they offer at the spinal cord injury centres. We can take people who are ventilated or with a tracheostomy, and we can work collaboratively with the NHS services to perhaps get their tracheostomy out or wean them from ventilation, that sort of thing. When at the spinal cord injury centres, they maybe have only like 1 or 2 beds that can do that. And obviously there's a vast number of people that can do that. So how does the private sector support the demands on the NHS? And what does, I guess, that funding stream look like for people? So I think, the networking and the collaborative interdisciplinary working is the key for people with spinal cord injury.
Great, thanks, Alice. That theme of making sure that there is some kind of equality of access based on awareness and understanding and things being joined up seems to be a central theme. Thank you. And Andrew, you're going to get the last word. Things that you think would make a difference in the future if you could change them or move towards them.
Yeah, obviously our involvement is in a much sort of more small atmosphere than Emma and Alice, but it's absolutely correct that collaboration from the start with the whole team, making sure that conversations are being had as early as possible, and the correct input is being gained from occupational therapists, family, everybody else involved with a client, just means that any property considerations can be more considered and realistic goals can be set. We have the greatest effect when we are involved to help set expectations as early as possible. But what our job is to do is to make sure that we are just collating everything which we're getting from the team of professionals involved and then trying to translate that into some realistic, property goals. With obviously immediate need and then looking towards the future. The key thing, which I sort of said earlier, was making sure that we're involved as early as possible, because it can take 3 to 6 to maybe even 12 months to secure, adapt, and make a rental property suitable for somebody. So when you think about that in terms of somebody's timeline, having that consideration as early as possible in the process, where it might seem like it's far too early, actually means that we can get something ready for when it is needed, and somebody isn't just sat waiting for it. While we're then carrying out what we need to do.
I think positively, I agree with all of that, and I think positively, we've seen the conversation kind of evolve in all sectors. I think this notion of collaboration, I've seen it it's just more of a theme in recent times, I think. And, you know, I mentioned at the start, we had this conference in February at our office, and the number of just hugely specialist and informed and, you know, passionate people willing to share information and learn was really quite striking. And I think that's really positive for the SCI community generally. I know there's a long way to go in every respect, and we could talk all day about the challenges, but I think positively reflecting upon how the conversation's evolved is a really good thing. And ultimately, you know, that's how we, you know, from my perspective, we end up with a bespoke case built around somebody by having input from all of these different, like, amazing professionals, and building a case around somebody, because ultimately, you know, it's about them and their families and understanding their specific needs, which might be different from one person to the next. And it doesn't really matter, you know, what we want to see from people. It matters what their goals are and what they're content with. And, you know, I could say to a client, I'd really like it if you would try this or think about this or look at this. And it doesn't matter, you know, it's not my job to tell clients what they should be thinking about, what they should be aiming for, what they should be looking at. It's my job to listen to them and to have them informed by the best people around them on different aspects of their care, and to build a case that is supportive of those choices and those goals.
Great, thanks, Emma. That's a really positive note on which to conclude our discussion. So there you have it. I think over the course of the last sort of hour or so, those contributions have highlighted a range of areas in which we could design a brighter future after a spinal injury. I'd like to say a big thank you on behalf of NR Times to our fabulous panellists, Emma, Alice, and Andrew, and thank you very much indeed for sharing your insight and I think a very positive view about the future of spinal injury care. For all those that are watching this, please share it as widely as possible with your networks. I think this discussion has been wide-ranging and it deserves to be seen by as many people as possible. So thank you for all those that are watching. On behalf of NR Times again, thank you very much indeed to our panellists, and enjoy the rest of the day wherever you are. Thank you.
Thank you.
Thank you.